Hey, what's up, peeps? It's Dr. Talbert. Welcome back to my channel. Today I'm going to do a video on America's top health questions according to Google. So stay tuned. These are the questions that people in America have Googled the most regarding their health. So first question is, how do I lower my blood pressure? Which is a really good question. One of the most common diagnoses that I see in my clinic is high blood pressure, and I usually offer a variety of ways to treat it. One being medication, of course, but I also encourage people to do a few things regarding their diet as well and their activity. I always tell people to increase their exercise and activity. That will help lower your blood pressure. I also tell people to eat more fruits and vegetables and less processed foods. This is called the DASH diet, which was actually scientifically studied and proven to lower people's blood pressure. So less sugar, less processed food, more vegetables, more whole fruits to lower your blood pressure. Work to lose weight if you are overweight, because that can be contributing to your blood pressure elevation. If you smoke, you should work on stopping, because that will help to lower your blood pressure as well. Recently, and I say recently, but more so over the last few years, but there's been a kind of change in definition of what elevated blood pressure is. It used to be the classic was that, 140 over 90 was elevated blood pressure. But now we're finding that even at lower blood pressures, you still can be at elevated risk. So for most people, the recommendation is to get the blood pressure as close to 120 over 80 as possible. If you're older or have other health conditions, that recommendation can change. So moving on, the next question is, what is keto? I bet a lot of you have heard of a keto diet, and you may not necessarily know what exactly that means. A keto diet is a diet that is working to limit the amount of carbs that you eat every day so that you can achieve a state of ketosis. And ketosis is when your body starts to use fatty acids for energy instead of glucose. Ketosis is a naturally occurring process that our bodies use when we are in states of low energy. The theory behind the keto diet is that when you are in ketosis, you will be burning off the fatty acids and be able to lose more weight than you would have otherwise. So keto diet, low carbs, high fat, working to stay in a state of ketosis. My thoughts of the keto diet, I think that it can work, but I'm not sure that it's any better than any other diet. You really just have to work to control the amount of calories that you're eating. Unfortunately, we probably will never know which diet is the best. And that may just be because there is no one particular diet that's the best for everyone. So I think you should work to figure out what diet is best for you with input from your doctor. I know that answer may not be what the keto community wants to hear, because I feel like there's a lot of people that are on keto diets and they swear by them. I'm not saying keto diets are bad. I'm just saying that they may not be better than anything else. The next question is, what causes kidney stones? And this is actually a really good question that we may not know all the science behind just yet. But we do know that dehydration is one of the main causes of kidney stones. And for people that don't know what a kidney stone is, basically it's just a stone mostly formed from calcium, but can be formed from other things, that forms in your urine. The problem is, though, that all of the, for lack of a better term, tubes that the urine flows through in your body are pretty narrow. So even a very small stone will disrupt the passage of urine and cause irritation. And that's where the pain comes from when people have kidney stones. Another cause of kidney stones is obesity and a sedentary lifestyle. We've also found that consuming high amounts of animal protein and high salt diets also contribute to kidney stones. There are also some medical conditions that can increase your risk of kidney stones, being Crohn's disease, renal tubular acidosis, hyperparathyroidism. And some people are just more prone to form kidney stones than others. And I'm not sure that we fully understand the science behind kidney stones, like I said. Another highly searched question on Google in 2019 was, how do I lower my cholesterol? A little bit of background on cholesterol. There is good cholesterol and bad cholesterol. In an ideal world, we would increase the good cholesterol and decrease the bad cholesterol. That's the aim. So when you say lower my cholesterol, you really are referring to lowering your bad cholesterol, which is your LDL cholesterol. To lower cholesterol, you can work on changing your diet. So that means avoiding trans fats, replacing saturated fats with polyunsaturated fats. We have found that diet may not play as high of a role in your cholesterol as we previously thought. There are some medical conditions like familial hypercholesterolemia, which is just a fancy word to say that high cholesterol runs in your family. And we're not talking about a little bit of cholesterol. These are really elevated levels of cholesterol that is difficult to control. Having diabetes, drinking a lot of alcohol or being overweight can also increase your cholesterol. Fortunately, we do have medicines called statins, which work really well to lower people's cholesterol and decrease their cardiovascular risk. There's some other medications for cholesterol as well. And the final most searched health question, according to Google in 2019, was how many calories should I eat in a day? Now, to answer this question, I have to give you a lot of caveats. The amount of calories that you need in a day really varies a lot. It's based on your age, it's based on your sex, it's based on how much activity you do in a day. So it's pretty complicated to give a single answer on how many calories you need in a day. Generally, women need from about 1,600 calories to 2,000. Men need somewhere around 2,000 to 3,000. But of course, that's highly variable, like I just said. There are online calculators that can help you figure out how many calories you should be eating in a day, but probably you should talk to your physician and a dietitian. I want to end with a disclaimer, just to make my lawyers happy. I am a doctor, but of course I'm not your doctor and I don't know you personally. I hope that this video is entertaining and informative, but I don't want you to make health decisions based on this video. You should always seek out your own personal physician or healthcare provider to help you answer these questions as they pertain specifically to you. And with that, thank you for watching this video. Be sure to like it, subscribe to my channel, and comment below with any questions that you have that you want me to answer. Thanks for watching.